Hello and welcome to this video. My name is Erica Rice and I'm an education coordinator here at the Alzheimer'S Society of Simcoe County. In this video, I'll be talking about the different programs and services that the Society offers to people who are living here in Simcoe County. I'll also be mentioning members of our staff team and our various roles. This video is current as of April 1st, 2021. There are many ways that clients can get connected to the Alzheimer'S Society of Simcoe County. So our clients can either be people who have received a diagnosis of a dementia or family members and friends who are supporting someone with dementia. Oftentimes a doctor, a healthcare provider will make a referral, a formal referral to the Alzheimer'S Society when a diagnosis is made. Or another healthcare provider, sometimes it's the Barry Aging Well Clinic or the Seniors Care Clinic in Aurelia, maybe a family health team here locally. But people can also connect to our services just by calling into our office, and at the end of this presentation will be listed our contact information. So sometimes we get people just calling in and saying this is, I'm either supporting somebody living with dementia or I've recently been given a diagnosis. What kinds of services do you have and how can I get connected to that? And that's perfectly okay as well. When somebody is referred, whether they have been referred by a healthcare provider or they've called in to request service, what usually will happen is that a First Link referral form will be filled out with all of their information, and it's given to the First Link Care Navigator. And so she will go through the forms and determine whether or not to connect them directly to other staff, whether they're looking for education, and we'll forward it to the education team or to the support team. But oftentimes she will be the one to contact the person who's been referred or the person who's called in, find out more about their situation, determine what kinds of services that they need, get them connected internally with our services, and sometimes also we'll refer them out to other services, for example, an adult day program or transportation services or whatever it is that the client is needing. Now, our First Link Care Navigator is Michelle Menicola, and you'll see her pictured here. She is the friendly first contact for many people who are referred to the Alzheimer'S Society. So with our supportive counseling program, we do have 5 family support coordinators on our staff. And the family support coordinator role is to support either care partners, so family members or friends who are supporting somebody living with dementia. And in some cases, they also support a person who's been recently diagnosed with dementia. They often provide that emotional support, answer specific questions, help people get connected to other services. Sometimes they'll help families kind of work together if there's some family issues. They become the client's go-to person, the person that provides the ongoing support over time. They primarily work in the geographic regions that are listed here. So we have Barrie and area. We have one that works primarily in the South Simcoe area, Bradford, Beaton, Tonham, Alliston. Another one who works in the South Georgian Bay area, that's Collingwood, Stayner, Wasaga Beach, that Georgian Triangle. North Simcoe, Midland, Penetang, Tay Township, Tiny Township. And then Aurelian area, Brecon, Washago, Ramera, and so on. The intensive case management is a specific program, and this is for people living with dementia who have either very limited support or no support. So they don't have family and friends around who can help them. So the intensive case management is to help them get connected to services, help them manage the healthcare system, and to be that primary support for the person living with dementia. The Society also has a number of different support groups available. These are peer-to-peer groups. They're drop-in, no registration is required. They're led by a family support coordinator and often co-facilitated then by a trained volunteer. The support groups before COVID were happening in different communities throughout the county. Now that everything is virtual, there are currently 5 monthly groups that are held. 2 are held in the evening and 3 during the day. They're all being held on Zoom. And here's our supportive counseling team, our 5 family support coordinators. We have on the far left Heidi Haupt, so she covers primarily Barrie and area, but she also does the intensive case management. Heidi's been with us for a long time, about 17 years, and beside her is Susan Nagy, who's also been with us for a long time, about the same amount as Heidi. Susan covers primarily the Aurelia and area. Sanju Hirji is our South Simcoe Family Support Coordinator. So the Bradford, Alliston, Tottenham clients who live in that area. Meredith Joy is our North Simcoe Family Support Coordinator. So Tay Tinley, Midland, and Penetang. And Dana Bassett is covering South Georgian Bay, Collingwood, Wasaga Beach, Stayner. Sometimes the family support coordinators will move across geographic regions depending on the caseload, how many people require service, but this is primarily the different areas that they're responsible for. They also each lead one of the online support groups as well. So that's our support team. And new to the Alzheimer's Society, with some funding that came through with the most recent dementia strategy, is a new program called the Enhancing Care CARES program. This is a program that was developed by the Reitman Center. CARES stands for Coaching, Advocacy, Respite, Education, Relationship, and Simulation. So this is for family care partners who are really struggling. So maybe they've come to education already, they need some more help to help manage their caregiving situation. And so it's an 8-week program. It does teach more problem-solving techniques and communication skills, and they do use trained volunteers who are like actors so that the family members can interact with these individuals and try out different responses, communication techniques, and so on. So it is quite a unique, interesting program. Again, it's new to the Alzheimer's Society, so we're excited to see where this goes. And introducing our Enhancing Care program clinicians. So the program is led by Tony Jacobs. Here she is with her dog Maggie, and she does the work with the clients who are enrolled in this program, walking them through the 8 weeks and coordinating that program for us. Now for education, so I'm one of the educators here at the Alzheimer's Society. We have different groups that we do provide education to. So we do education for people who are living with dementia, usually the early stage of dementia. So somebody's been recently diagnosed with Alzheimer's disease or another type of dementia. First Steps is our 4-week education program for these individuals, but we also have Taking Control of Our Lives, which is an 8-week self-management program. Currently on Zoom, we're kind of combining the content of these two programs to offer a 6-week Living Well with Dementia, which is delivered 1 hour a week over Zoom. And that's primarily because, especially the self-management program, we just couldn't deliver it the way that it was designed virtually. So we've kind of created this Living Well with Dementia as a hybrid for the time being until we can go back to in-person programming. We also do a lot of education for care partners. So this is for family and friends who are supporting somebody living with dementia. So we have a number of different series offered for this group of individuals. And they are more focused to different issues at different stages of dementia. So we have Next Steps is the introductory course of things that families need to be aware of or should be aware of early in the disease, things like managing risk and adapting activities and so on. And then as the disease progresses and their caregiving situation changes, things that might be more applicable to them in the moment, things like responsive behaviors and enhancing communication and so on. So we have a number of different options for family and friends. We do come in and help with some healthcare professional training. So there are other trainers in the area, the psychogeriatric resource consultants who take the lead on this, but they will sometimes ask us to come in and co-facilitate a training, or if it doesn't fall within their mandate, we will come in and provide the professional training. But that's not our primary goal here at the Alzheimer's Society. We do education for the public. One of our key offerings for the public is called Heads Up for Healthier Brains, and this provides information about normal aging versus not normal aging, the risk factors for dementia, and ways to keep your brain as healthy as possible. So we offer that on a regular basis. It's open to anybody who is interested in brain health. But we do also offer other presentations, often on request. Before COVID, we were doing lots of different presentations and health fairs. Now, because of COVID and everything's online, we aren't doing as much of that, but we are still offering different public awareness opportunities. And that's also including some of our social media campaigns. And we're doing every 2 Mondays, we do a Facebook Live at noon to address different topics of interest. So there are other things that we are offering right now. So just to introduce you to our education team, so again, my name is Erica, so that's me on the right, and I cover primarily when we were in person, I covered Orillia, North Simcoe, and South Georgian Bay when we were doing in-person programming. So we would often do our education. We would partner with organizations, say in Collingwood, often with the Georgian Bay Family Health Team, or in Orillia with the Senior Care Clinic, and hold programs in those spaces. Since COVID last year, we've been doing everything online using Zoom, so those geographic regions, it gets blurred. We kind of just work together. Boujee is brand new to the education team. She was doing Minds in Motion up until now in our social programs. So she, as of April 1st, has joined the education team and will be working, helping us provide all the education I just mentioned on the previous slide. So thinking about Minds in Motion, so Tara has been our Minds in Motion coordinator for the last few years and has done an amazing job growing this program. It is a social rec program for people who are living in early to mid-stage dementia. So they usually, before COVID, this would be an in-person program. People would come with their partner in care, usually a spouse or one of their kids or someone. Although we did have volunteers to also support people who maybe were coming on their own, and it would incorporate that easy to follow physical activity and also have an hour of just socializing and fun cognitive games. A very popular program. Right now it's all been offered online. So the cognitive games groups are time limited to 8 weeks. So they go in 8-week blocks. But there is also a weekly online exercise group and a weekly online coffee social group. And this is more of a drop-in, come where you want, ongoing sessions. And we've been fortunate in the last year or two to get different pots of funding that have allowed us to offer more programs for people living with dementia. So these are some of the programs that we're currently offering. Right now we are running a Creative Connections group in partnership with Quest Art School and Gallery, which is located in Midland, but the program is being offered online. So people anywhere in Simcoe County can join in. We delivered, I guess, care packages of art supplies to the different clients who are registered for this program, and they are making their creations together over Zoom each week. So that's quite an exciting program that we're offering. We've also had some funding to offer musical memories, which has been happening in 6-week blocks of time. So they started back in the fall, and we've had funding to continue this for a while longer, and have partnered with Music Therapy Services Simcoe County to provide this program. So that's been happening weekly as well. And we also received funding to provide activity kits. So here you'll see an example of one of our activity kits. And these have been provided for free to different clients. So our volunteers and also staff have been busy delivering these to clients throughout Simcoe County. And just a note, because Terrell is moving to education from Minds in Motion, we are currently in the process of hiring a new Minds in Motion coordinator. And the Alzheimer's Society, we are a registered charitable organization. The Alzheimer's Societies in Ontario, each local society is its own charitable organization. So the Alzheimer's Society of Simcoe County, we do have our own charitable number and our own board of directors. About 40% of our current programs, the funding required to deliver those programming, the programming that I've talked about in this presentation, is coming from donations from people in our area. So donations that are coming directly to the Alzheimer's Society of Simcoe County. And we get those donations from our different fundraising events, which this year with COVID has been really difficult because a lot of our events usually happen in person, and so it was a very quick change to try to offer events online, but also through direct donations. So people who are making a donation directly to the Alzheimer's Society of Simcoe County. If people are making donations to the Alzheimer's Society's direct mail campaign, it will filter down in part to the local society if the donation came from somebody living in our area. So, you know, it's good to know the different levels of the society, that when you're donating to the direct mail campaign, you're supporting the Alzheimer's Society nationally. But if you wanted to support the work of the local society, it's best to make your donation directly to the Alzheimer's Society of Simcoe County. And you can always call our office, 705-722-1066, and make a donation online or make a donation on our website. When you think about the fundraising events, so a lot of our volunteers help out with our different fundraising events. And hopefully when COVID is over, we're all vaccinated, we can go back to in-person events, and we'll certainly need a lot of volunteer support then. Our Walk for Alzheimer's is a signature event. It is coming up at the end of May, and it will be virtual again. So we aren't able to hold this in person this year, but we do certainly need a lot of support. So especially awareness and telling friends and family, that peer-to-peer fundraising that's happening online is really important. We did have some people doing coffee break in the fall, certainly within some organizations, so we get some funding that way. So it's been a tough year, but we've been managing to get things online, and we certainly love to help the help and support from volunteers and community groups to help keep our programs running during this difficult time. So we do have our fund development team here. We've got Catherine, who's our events coordinator. So she's the lead to coordinate events like the Walk for Alzheimer's. I'm very busy doing that right now. And Sandy McNevin, so she's the fund development coordinator. So Sandy's role is more donor cultivation and development, getting corporate donors and so on. And last but certainly not least is our support staff and leadership team. Shannon Graham is our admin assistant. So Shannon's the one who you might, answer the phone in our Barrie office, receipt the donations that we receive, all those kinds of back office stuff or things that make the team run. She is currently covering a maternity leave for Kristen Flood until summer of 2022. We have Marguerite Glanfield, who is the volunteer resources coordinator. So she's the one who, if you're a volunteer, you'd be connecting with to start the process of how to get connected with the society to volunteer and support our programs. Lynn Barasa is the manager of support and education programs. So all of the education, support, social rec programs, she is the person who oversees the staff team, that program area. And then Debbie Islam, probably my little video is covering her spot, but she is the Chief Operating Officer. So she's the one that is managing the whole organization. If you'd like to contact us about any programs that I've talked about today, here is our main office phone number. That's for our office in Barrie. The email address is for our admin assistant, Shannon Graham. The website is for our local society, Simcoe County. And then also our main social media accounts. So Facebook is Alzheimer's Society Simcoe County, and then Twitter and Instagram. So you can contact us on any of these. We do monitor the social media as well. So please feel free to reach out, and we will do our best to get back to you as soon as possible.